what we found is that we can actually use liposuction to shape the person. We call it liposculpturing now. They come in and they say, I don't like my body. I don't like it the way it is. My belly's too big. I want my stomach flatter. I want my butt bigger. They're not always able to articulate exactly where they want it, or they'll bring a picture of somebody and say, I want to look like this. But they won't be able to tell you, to get from here at point A to point B, I need a smaller stomach, a bigger butt, a narrow waist. You know, they haven't analyzed it like that, but they like this particular shape they've seen on somebody in a magazine. I see that with your frame, if we just brought your waistline in a little bit, brought your belly in and your lower back, and rounded out your buttocks, then you can get from point A to point B, and just with liposuction. By the time you're done, even without adding any fat to the butt, they have a shape. They have a nice shape. Generally, it's about 2 hours worth of work, I would say, on the average. Sometimes you have to do the belly and the sides while they're laying on their back, and then they'd have to turn and lay on their stomach so you can do the lower back. So there is some positioning element to it that can take up some time. But normally within an hour or two, you can get most of that done. Can you do it in the office? Yeah, you can. There are some people that can be done in the office with minor sedation and lots of local, especially if the areas you have to sculpt are limited. When you now have to sculpt the front and the back and the hips and the butt, then they're better off going to sleep. So I would say probably about half of them can be done in the office. And then, you know, you're kind of out of it for 24 hours. By the second day, you're up and moving around. By the third, fourth day, you're back to normal activity.